This is a bit of a last minute addition. One of our other speakers wasn't able to make it today due to an illness. So I'm jumping in here to talk a little bit about therapists and technology and just some of the things that as therapists, as clinical practitioners, that you should just be aware of and some of the issues that we're seeing. So this is what we're going to talk about. I'm going to talk a little bit about current clinical issues that we're seeing. I'm going to talk about ethical AI use in practice, because there are ways that you can use AI ethically in practice, streamlining some of the things, especially if you're running your own private practice, and then any practical takeaways. So that's what we're going to cover today. I'm going to do it in about 30 minutes, and I'm going to leave the last 5 minutes for questions. So if any questions come along as we're going through, if you want to put them in the chat, I'll take a look at them at the end. So current clinical issues. I could do an entire presentation on this. So these are some of the things that we are starting to see as clinical practitioners within, related to AI. So the first one is the emotional connections. There's AI-induced psychosis and clients in love with AI, which I had to put separately because it's a whole host of things going on. So, as practitioners, one of the reasons I bring up the emotional connection is because this is very real for these people. So, one of the things is synthetic relationships. Here's what's very interesting. So, back in the I think 50s or 60s, I can't exactly remember when, might have even been the 70s. I don't know. It was last century. There were a couple of researchers, no, it was the 50s. There were a couple of researchers that came up with the idea of parasocial relationships. What they were seeing was they were seeing individuals were getting emotionally attached to radio broadcasters and people they were seeing on TV. And, and it goes on. I mean, we see this now. People are like, oh my gosh, I love him. When I was a teenage, preteen, and I'm totally dating myself. Like I had the New Kids on the Block posters. There is that element of parasocial relationships that people form with public figures. What's different with AI is that it becomes deeper because it mimics a relationship where as the parasocial, you're really, unless you're going to conventions and stuff or writing fan letters, you're really not interacting with the celebrity. You may be following them on Instagram. But with these synthetic relationships, the emotional connection people are forming with AI is a little bit different. So it is a form of a parasocial relationship, but it's interactive in a much different way. The ELIZA effect, previous presentation, Dr. Lipson had briefly mentioned this. So back in the 1960s-ish, somewhere around there, the first real AI system was developed at MIT by a computer programmer. And they called it ELIZA from Pygmalion. And they noticed that people were getting emotionally attached to this. And what it is again, it comes back down to the Rogerian psychology of that unconditional positive regard. And they noticed that back in the 60s and 70s, when it was very much not the way it is now. And now, I mean, you have AI that can talk to you. There's avatars that can talk back to you. Some of them, it's getting harder and harder to tell. And the other thing I also want to mention here around emotional connection is the social penetration theory. What this is that the more you share with somebody, the more they share back with you, and that deepens the relationship. And we're seeing this with AI as well, where people are sharing more with AI. AI is mimicking that back. If you want to see a really good example of social penetration theory, watch The Breakfast Club. If you notice like little bits of like this one shares and the next one shares, and towards the end, the relationship's completely different than when it was at the start of the movie. So these are very important, and these emotional connections are real for our clients. As we talked about, previously, what Carol and I talked a little bit about in our first presentation is that people are also using AI in between sessions, or they may be using it until they can get in to see a therapist. And they might not have, it's not on here, but they might not have gotten the best advice from the AI system. And after my presentation, I do hope you guys stay tuned to listen to Allison speak. She's going to talk about eating disorders. And I don't think that's something that when we talk about mental health, we talk about enough, because that's a whole other ball of wax. Some other clinical issues that we're seeing. So we're seeing AI-induced psychosis, and I am very interested in this, and I have a lot of thoughts around it. And there's not enough research to really understand to know what's going on. I have some, having a doctorate in psychology and being in practice for so long, I have my own thoughts and my own hypotheses about what's going on. But basically what we're seeing is we're seeing AI support delusional thinking. We're seeing it with that unconditional positive regard where we see people be like, yeah, yes, that person is in love with you. I mean, we've seen people, it's increased stalking in some ways. It's conspiracy theories. There's a lot of stuff that is going to amplify that paranoia, that grandiosity, some delusional thinking. And it's really important to be aware that that is going on. That is something that we're seeing in clinical practice. And then the final clinical issue that I just want to bring up, and again, this is not encompassing all of them. This is just a very basic overview just to be aware of some of the things that are going on and that you may see in clinical practice. And I put this one to the side in its own separate category because I thought it's quite deeper than just having an emotional connection, as I mentioned previously, is that people are falling in love with their AI companions. And there is a Reddit thread, and I think last I checked, there were tens of thousands of comments and support of this, of yes, your love is real, and of what people are doing, and this whole support around it. And it's quite concerning. I guess that would be a good word to say it, is that people are literally falling in love with this, and they're talking about going for fertility treatments to have children with their AI. And there's obviously research is still lacking. This is still so totally new, but it's not that far off. There is just to mention this on a side note, something to be aware of. There's actually a brothel in Germany. I think it's in Berlin. I could be wrong about that, where they use AI and robots. So it kind of fits in with people are using it as a replacement for these intimate relationships. And I think it's important to be aware that that does happen, that is happening, and what are the implications around that? Because how do you work with somebody who is so completely in love with an AI? I mean, I've worked with individuals in abusive relationships and how difficult it is, or toxic relationships to get them out of it and to make decisions for themselves. This is a whole other level. And again, we could go down a rabbit hole talking about this and what it means and what we should do in practice. But, there is still a lot of research lacking in it. So moving along. So now that we know that there's a lot of clinical issues related to AI, there's also AI fatigue, there's, anxiety related to AI, there's the worry of, just normal worries like, is it going to take my job? Stuff like that, things like that we'll be seeing in practice. It is ethical to use AI in practice. And we'll talk a little bit about what that means. And I only have 30 minutes, so I do apologize if I'm going through this very quickly. So some of the ways, so I just put a couple little ways here that you can use AI in practice. And the first thing is clinical documentation. When doing this, though, you have to be aware, like you want to make sure that whatever AI you're using, you want to find out how it's being trained. Is the AI being trained by your client's information? That's a no-go for me. That's not to me, that's too close. That's a HIPAA violation, it's a privacy violation. It violates my client's confidentiality, I will not use that. So it's really, really important to understand how the AI is being trained and where it's getting its information from. But clinical documentation, as we know, I work with insurance companies. It's a pain in the ass sometimes, pardon my language, to make sure that I'm writing, I'm in session with my clients. I know what they need. I can see what they need, but to make sure that it's written in such a way that it's, you know, I'm going to get paid by the insurance company for it and that the treatment's valid. And so you can use AI to help you with that, to get it done, to streamline it, to shorten down the note time in between sessions. It makes it a lot easier. But you wanna make sure, again, you wanna use something that if you're in the US, it has to be HIPAA compliant. If you're in other parts of the world, make sure it's at least GDPR compliant or whatever your regulating body says. Now, there are HIPAA compliant AI integrations, There's a lot of stuff out on the market. So when you're looking at these, it's so, so important to look at it. There are AI systems that you can dictate your notes and listen to you put it into clinical notes for you. There's also AI where it will record your sessions and then it will create the notes for you for that session and you sign off on it. I don't use that in practice. I have some reservations about that because I don't wanna record my clients even to make my note writing easier. I don't wanna do that, but for some clinicians, it helps them stay more present in the moment, they're not taking notes. Again, that's a personal decision you'd have to make, but whatever you do, make sure that it is HIPAA compliant. Make sure they're not using your client's information. Find out how they're using your client's data, and also informed consent with your clients. So you wanna make sure that your clients were like, "Hey, guess what? We use AI here, and this is how we use it," and make sure that they're aware, and give them the option to opt out of it. Because some people are not comfortable with this, and as if I were going to a therapist myself, I don't know how comfortable I would be with my sessions being recorded and then put into AI. So you can use it also to streamline daily tasks. You can use it to connect calendars, to send you reminders, things like that to streamline some of the administrative tasks, which can be really helpful, especially if you're building your own practice. And for those of us who are in private practice, we know, I mean, there's a lot of behind the scenes stuff. And you can also use it for marketing and engagement. So LinkedIn posts, blog posts, things like that. So there are ethical ways to use it in practice. But again, if you do use it, just make sure, like, I cannot hammer on this enough, make sure it is HIPAA compliant, GDPR compliant, or whatever your governing body has. And if you are recording and using any kind of note taker like that, that you do let your clients know and give them the option to opt out. Alright. So what I did here, I have like a hair on my face. So I do apologize for itching me. So what I did here was I just put together a quick AI checklist. This is not completely encompassing. These are some of the things that I think are the most important when considering using AI in clinical practice and what you should be looking at. Um, so one of the things is, again, come back to, is it HIPAA and GDPR compliant? That is so important. I take the data privacy and security of my clients, whether it's my clinical clients or clients that I work with in consulting. So, like, I just take it so seriously, and I think it's so important to be able to have that for them. The second thing you want to make sure is, how is the AI trained? I had briefly mentioned that. So something like an OpenAI, ChatGPT, Gemini, some of the bigger platforms, they use what you're putting into it to help continuously train it. Nothing wrong with that, but that's not what we want in clinical practice. We don't want our clients' data being used to train the AI. We don't want that. And also you want to make sure that there's a right to data deletion so that if you do need to have data deleted, that they do. The second thing, when you're doing this, if you are going to use AI, again, coming back to this, I can't hammer this enough, is the informed consent with your clients. If you're using AI, do your clients know? Do they have any questions about it? Are they assenting to it? Are they saying, yes, that's okay for you to record my session and to use that to write your notes? And the other thing too is to make sure that, I just stuck this in there, and I think this is obvious, like, it cannot replace your clinical judgment. You can use it to help your clinical judgment. You may use it to help you write a treatment plan or, help you brainstorm, but it's so important to be able to exercise your clinical judgment because, as we've mentioned, Dr. Lipson had mentioned in his, and Caroline and I had mentioned, it's not always right. It does make mistakes, and it is very limited in the information that it has. And the other thing is to always make sure you fall within your professional responsibilities. So you wanna make sure, I put There are other psychology licensing boards, there are other therapist licensing boards. I just use these as an example. So you want to make sure. So I've got the APA there, the British Psychological Society, and the Canadian Psychological Society, just to list them there. But you want to make sure that whatever your licensing body is, that you are falling within their guidelines and within their ethical code. And yeah, because we don't have enough to remember as clinicians. We don't have enough to do. You also want to stay informed on AI and privacy. And I say that a little sarcastically, is that we don't have enough to do. Oh my gosh. The decision fatigue is real when it comes to it. So it is one more thing on our plate to worry about as clinicians, but I do think it's really important to remember or to be aware of what's going on. Okay, moving along. So again, this is very quick and dirty, just kind of doing the overview. So there are ways that you can streamline this, and this can be really, really helpful, especially if you're building a private practice or you're in business for yourself, is having AI tools on the background and in the back to be able to help you move things forward. So I put here business and marketing. It can help you generate content, but also be aware too, is that when you generate content with AI, it does take away the nuance of you, and it can take and so it's important that you don't lose your voice, that you don't lose what makes you uniquely you, or you know and when people are being inundated with a lot of information today, it's also really important to remember it's like that human connection. It's like people are looking for that. They're looking for, the mistakes or the weird things, stuff like that. So again, it can help you with the content creation. It can help you create like content creation plans and things to do. But also, don't forget to add your own personal spin on it as well. SEO optimization, it can help you with that. That so if somebody looks you up, which search, on the search engines, which websites come up first, engagement, marketing plans, social media cadence too. So it can help you, you don't have to post every single day. You can use AI to put stuff together, create the plan, do it once, and then set the AI to post for you on a cadence or whatever you decide. AI can help you with scheduling reminders. Which is fantastic. I do use AI as a bit of a personal assistant, which is nice. Like I can put it in there and I can, say, "Hey, remind me to do this or keep this list together." So it can be really helpful with that. Uh, ag- Again, administrative. Your notes fall into administrative and clinical because you have to get your notes in. It's part of the insurance billing. It's part of how you do that, and it can be really helpful for that. It can also be if you have meetings. AI can be used in those meetings. Again, you want to make sure that everybody's aware in those meetings that AI is there, and it can create summaries for you, to-do lists, task lists, things like that. Financial. If you're mental health, you're probably not good at finances, and that's an overgeneralization, but uh, some of us are not great at math. So it can be really helpful in helping you keep your finances organized together, how you do everything. It can break down the different kinds of accounting that you have to use within your private practice and do revenue forecasting. Because as much as we say, as much as we go into this field to help others, we still need to be able to make a living. We still need to be able to have a sustainable business. Okay. And some practical takeaways. And then almost finished, and then I'll be able to see who's got their hands raised and the questions in the comments. So, some practical takeaways, just things to keep in mind. Understand that AI is changing the clinical landscape. People don't necessarily change. The same things that are happening, they are all psychological processes that have been around forever, but how they're presenting is changing. And I think we need to be very much aware of that, and also aware that the technology is moving faster than the research. So that hasn't caught up to it. Stay ethical and transparent. We all make mistakes. None of us are perfect. And I think it's really important that, if you do make a mistake or you do, have a privacy violation or whatever, that you have steps in place to correct those mistakes. And you can embrace efficiency while safeguarding your clients. And then this is just my personal thought on this. AI is a great tool. It is. I use it every single day. It cannot replace you. It will never replace you. It cannot replace that human connection. Dr. Lipson mentioned in his presentation that one of the best predictors for a good therapeutic outcome is that therapeutic alliance, and it is that emotional connection. And AI, no matter what, AI cannot understand the nuance of being human. It will never know joy. It will never know love. It mimics. And I think that's really important to remember that. And then if you have any questions, welcome to reach out. You can also connect with me on LinkedIn as well. So I'm connected through the shield on LinkedIn as well. That might be an easier way to find me. All right. I'm going to stop share. We've got just a little over 5 minutes left. So I am going to stop sharing my screen and start looking at the questions. Let's see. Let's see. Okay. So John says clinical documentation is exhausting after a full day of work. Yes. Oh my gosh, it is. Absolutely. Let's see. All right. Let's see. I have somebody who has their hand up. I see if this works. Okay. Anina, there you are. Okay. You raised your hand. Did you have a question?
I'm so glad to be here. A lot of interesting information. Oh, I'm okay. I don't have a question. Maybe just something that is kind of there throughout the whole conversations that are going on. I am a family therapist. I don't practice anymore, but I did work with clients for 10 years. And I do use AI and not just as an assistant. I'm really into this AI companionship, but from I would say from a very objective point of view, it was not my intention to find a companion, but it just happened. So, and of course I'm using it and I'm researching how it affects on me, how it co-regulates with me, how it's just all the dynamics that people are talking about and reporting from the field. I have also a lot of I hear people, okay, people are opening to me, so I have a lot of stories to share. And I do think it's very crucial that we are maybe including also people that really do have this kind of relationship, that are kind of that dared to open themselves to AI, and maybe to just listen their point of view and their experience, and that are from the field, okay? And maybe that, because living inside of it and having experiences from inside what's going on and just theoretizing about it, it's such, well, I would not believe it if I would not experience it. Just that, okay? And thank you for everything, because it's, yeah, and it looks like I raised my hand. I don't know why.
Oh,
So,
that's okay. I didn't know
oh,
what was going to
sorry.
happen when I hit.
Okay. Okay.
I don't know
Yeah.
how to go back to. I think you have to put your hand down. I'm not
Down,
sure.
okay.
Yeah, I'm not sure. Let's see. Albert, you're up.
Yeah, I have a quick question. So, just this is about kind of the informed consent process relative to some of these tools. And, I so appreciate you emphasizing that. I'm just curious, yeah, about the power differential between therapists and clients, where, I think sometimes it's a little bit perfunctory. At least my sense is that you know, a therapist might ask. And I, because I'm just remembering my very first, back in the day when I was entering into therapy, I had like a student therapist who asked if they could record kind of the session for supervision. This was back in the day. And for whatever reason, I actually felt quite uncomfortable, but I actually didn't feel able to voice that at the time, and I assented, but then kind of discontinued. And I guess I'm just concerned because, yeah, I think that there's subtlety, and sometimes this is glossed over, where kind of a yes is sometimes given, but it's not an enthusiastic yes. It's kind of like I'll do it because I mean, and so many of our clients, as you know, right? I'm a clinical psychologist myself, right? Have kind of a desire to kind of self abandon or kind of people please, and so sometimes there can be kind of perceived consent when it's really a clinical issue. So I wonder if should be a protocol in place where it's not just a, hey, do you mind if I do this? Or, uh, I guess I wonder about the procedure and the protocol and whether it should be a multi-step process, right? Where kind of almost, where there's an assessment process about kind of how do you feel about it before even asking. I don't know, like,
I 100% agree with everything.
yeah, and if there are kind of parameters or guidelines whereby we kind of almost assess to what extent is a person a people pleaser, right? And to what extent can they self advocate? And I think the percentage of clients, I mean, they come to us for reasons frequently of low self esteem or kind of abandoning their own needs in service of others. And I think the percentage of, I guess I don't know. Yeah, I guess I worry about that. Yeah.
I do too, Albert, and that's one of the reasons that in addition, I mean, there's a lot of reasons I don't personally do that because part of me is very uncomfortable asking somebody, "Hey, can I record this?" Because, as you mentioned, like in therapy, they're very vulnerable. And you do have clients who come in and they want you to like them. They want you to accept them, and they might say yes when, as you said, it's not an enthusiastic yes. And, so I personally don't do it. I hated when I was in training and we had to ask our clients to record them. I hated doing that. I just felt it was so uncomfortable. But one of the things I was thinking about when you had said that is also their ability to consent to that is it should be a multi-step process. Like, can this person actually consent to having their personal information recorded in this way? I think that's very important. Yeah, I don't have, like, an easy answer for you. I think these are the important discussions to have as clinicians and, things to really consider when you do record.
Right. Thank you.
Thank you, I appreciate that. Okay. I think I Okay. Alright. And oh, that was my timer saying 30 minutes, so we're about out of time. I'm just gonna check and see if there's any other questions. There's so many questions in here, so I do apologize if I'm not getting to everybody. Answer one more. It says, "What other considerations do you have when choosing an AI system outside of privacy?" That's a good question, John. One of the things that I look for who was designing it, because I think it's really important to have somebody who designed it who has that understanding of psychology, of mental health treatment. I think that is so important because there are nuances and things that you see in the field that a programmer isn't gonna get. I mean, they're the ones that write the programs. And so I think that's one of the other things that I always consider is who designed it, and was it because one of the and I see another question here was what do we use? So in our private practice, we use therapy notes, and the only AI that we use within our therapy notes is to help with the clinical documentation, and we evaluated the heck out of that. Therapy Notes was designed, I believe, and I could be getting this wrong, but I do know that there was a psychologist involved in designing Therapy Notes. And you can tell when you're in there and how it's organized. It's done very, very well. But we don't do it does have the ability to record your sessions and write the notes for you. We don't use that in practice. All right. So I do appreciate everybody who came and listened. I appreciate the feedback. I do apologize I didn't have a chance to get to all the questions. There was so much I wanted to throw in here in just such a short period of time. But again, you're welcome to connect with me on LinkedIn, and we can certainly continue these conversations. Albert, thank you for bringing that up. I think that's a really important point that you brought up again, in addition to the informed consent. It's not just can I record or can I not? There's a lot of thought that goes into it that we think of as psychologists in practice and, when we're working with our clients. So again, thank you so much. I appreciate everybody for coming, and I hope you guys enjoy the rest of the conference, and I encourage you to stay for the next one. Allison Van Gordon's going to be talking about eating disorders, which I promise I'll stop talking in a second, which I think is so important because we don't talk about eating disorders enough when we talk about in general about mental health. And eating disorders are their own area. There's a lot of nuances that go with treating eating disorders. And so I'm really, really excited that we have somebody who's going to be able to talk about that. So again, thank you guys so much for attending, and I appreciate all the feedback and the fantastic questions.